My name is Brian Samuels. I am the Commissioner for the Administration on Children, Youth, and Families. I'd like to thank everyone for taking the time to learn more about two very important initiatives under the responsibility of the Administration on Children, Youth, and Families. Today, we'd like to talk about the Personal Responsibility Program as well as the Abstinence Education Program. As most of you know, these programs are currently available for application. We're excited about both of these opportunities. Together, they represent about $105 million in federal investment this year alone. And we think both of them can play a very important role in reducing teen pregnancy in the United States. As many of you know, teen pregnancy is a serious problem. It's one that has a detrimental impact on the long-term well-being of both adults and children. And so we think that it is critical that we find the most effective interventions for addressing these problems. Together, the program for abstinence, as well as the program the PrEP program, which is intended to address both abstinence and contraceptives, we think can work in coordination with one another. We think they can complement one another because we recognize that most states have diverse communities and have very different populations that they would like to target in their efforts to reduce the teen pregnancy rates in their state. And so because we have both of these programs available, we're really encouraging all states to look very closely at the flexibility that is available in each of the programs, as well as the evidence that is available about the effectiveness of both programs. We think collectively they are important investments, and we think ultimately they'll have a real impact on creating positive futures for many young people in each state in the country. So again, I would just like to thank you for participating in this afternoon's webinar, and I'm going to hand the program off to Debbie Powell, who will tell you more specifics about the program and how your state can take advantage of the opportunities represented by these programs. So Debbie, thank you.
Thank you, Brian. Good afternoon and welcome to the webinar. I am Debbie Powell. I'm the Acting Associate Commissioner for the Family and Youth Services Bureau. And on behalf of FSBE, which is the acronym for the Family and Youth Services Bureau, and the Department of Health and Human Services, I am pleased to introduce to you FSBE's new teen pregnancy prevention efforts, the Personal Responsibility Education Program, or PrEP, and the Abstinence State Grant Program. These programs have come to FSBE as part of the Health Care Reform Bill, officially known as the Patient Protection and Affordable Care Act of 2010. Let me start by telling you a little bit about FSBE. At FSBE, we believe in empowering young people and families to build their own positive futures. For young people, we promote positive youth development. In a nutshell, PYD, positive youth development, is a belief that all young people can grow into successful adults if they have supportive home, school, and community environments in which to build skills, exercise leadership, and make a contribution. Another of our crucial underlying philosophies is cultural competence. We ask our staff and all of our grantees to recognize and respect the unique perspectives of people with different characteristics, backgrounds, and views. Both philosophies will be important components of PrEP and abstinence. Let me give you an idea of where FSBE fits within the federal government. FSBE is in the Department of Health and Human Services under the Administration on Children, Youth, and Families within the Administration for Children and Families. So I hope you got all that. One acronym is the ACYF, which FSBE lies directly under, and the umbrella agency is the Administration for Children and Families. I'm sure you've heard the acronym ACF. FSBE's four major programs are the Runaway and Homeless Youth Program, Mentoring Children of Prisoners Program, Family Violence Prevention and Services Program, and our very newest program, teen pregnancy prevention, which includes the Personal Responsibility Education Program, PREP, and the State Abstinence Program. Each year, FISB impacts grow. In FY 2009, we awarded more than $400 million to states, tribes, and communities to improve conditions for families and youth most at risk. 1/4 of FISB's grantees in FY 2009 were travel grantees. I am going to turn it over to one of the staff, LaBrita White, who is the program specialist and is listed in the FOA as the point of contact for any programmatic questions, to talk more to you about this effort with the PrEP program and the abstinence program. Just to aside, before we start, I wanted to really impact you on the purposes of the PrEP program and the abstinence program. Both programs promote the replication of evidence-based practices and the testing of innovative approaches for teen pregnancy prevention. Primarily, that's the PrEP program. And the abstinence program we will talk about later on in the presentation. So everything that you will hear initially from LaBrita White will be all about the PrEP program. So we don't want you to confuse the two programs. And we will give an introduction when we get to the abstinence program, so not to confuse the different program requirements of the two separate programs. So I will turn it over to LaBrita White now, the program specialist.
Good afternoon, everyone. As Debbie said, I'm LaBrita White, and I will be working with you all very closely over the next few months. We're glad that you were able to join us this afternoon for our first webinar on these new programs, as Debbie spoke of, that are now a part of the Family and Youth Services Bureau. I just want to direct your attention at this time to the agenda for today's call. Welcome and introductions. Unfortunately, we will not be able to hear from everyone who's on the line with us on today. The calls are muted. However, I want to make you aware of who within FISB and ACYF are participating. You've already heard from Brian Samuels, who is our commissioner, and Debbie Powell, who is our associate commissioner. We also have with us this afternoon Sonali Patel, who is our senior policy advisor, and again, myself, who will be walking you through most of the slides this afternoon and introducing you to some of the poignant areas of the funding opportunity announcement. Just want to go back and again, to review today's agenda, we will be providing an overview of the funding opportunity announcement. We've already had a review of FISB, and we'll make the slides available to you as it relates to the overview of ACYF. For the interest of time, we have a lot of information to share with you and cover today, as well as we'll provide for you an overview of PrEP and abstinence as it relates to the program expectations, application content, application submission instructions, as well as post-award state plans. Okay. And so we will begin. Bear with me just 1 second as I advance the slides. Just to make you aware, too, we also, not just FISB alone, but the Office of Grants Management is a key partner on the federal level for ensuring that funding opportunities announcements, they go out, as well as the awards are made to those applicants who meet the criteria. And so the role of the Grants Management Office, we want to share this with you, is primarily they're responsible for the actual awards that will be made and any of the business financial transactions as it relates to your actual awards, if you are so fortunate to receive an award, and we're hoping that most of you will, as well as they maintain the official grant files. As it relates to the review and award process, ACYF, again, has taken the lead, and we're the program office. We will be reviewing all applications and making those recommendations to the Office of Grants Management for awards, and the Office of Grants Management in turn will process those awards and make the necessary notifications to those applicants who were awarded either the PrEP and I should say PrEP and/or abstinence grants. As Debbie stated, we have expanded into having a teenage pregnancy prevention office within FISB, and because we have this office because of funds that were actually allocated and appropriated through legislation back in March of this year as it relates to healthcare reform. And so we have approximately $75 million that we are utilizing for programs and supports and services as it relates to teen pregnancy, specifically for the state PrEP, the state abstinence program, as well as a tribal PrEP program that we'll tell you a little bit more about later, which we have not as of yet issued a funding opportunity announcement for. Just to make you aware up front, we've made some modifications to the funding opportunity announcement for both PrEP and abstinence, and that information is currently available. The modifications primarily will address questions that have been emailed and or called in to the FISB office since the funding opportunity announcement was published. And I've provided for you here the web link. That's actually the ACF website, and if you go to grant opportunities, you will be able to click onto both of those announcements, the funding opportunity announcements, and you will see the frequently asked questions with responses from FISB located at that site.
This is Debbie Powell, and just wanted to make a clarification and put everybody's mind at ease. The modification is just grant terminology that we use to indicate that we have not changed anything in the initial form that you received, but we've answered all the questions, and there have been tons of questions that have come in. So the administrative process that is used to answer your questions is called a modification to the FOA. But the FOA itself, all the program requirements, everything that you read initially has not changed. So just want to make that clarification for you.
Thank you, Debbie. And also just to add, for the abstinence funding opportunity announcement, there were a couple of inactive links that were part of the announcement due to underlining, and we've removed those so that we will not have the issue that we were having before of persons clicking on and going to an expired funding opportunity announcement. So we cleaned up some things there. All right. Okay, first we'll start with the PrEP program, which is our personal responsibility education program. And many of you are probably already aware of the funding opportunity number as it applies, and hopefully most of you have already had an opportunity to read the announcement. Again, the legislative authority is the Patient Protection and Affordable Care Act of 2010, and it was signed into law by our President on March 23rd, 2010. Okay, the purpose of the funding announcement has several primary goals, and one of which is to fund programs that are designed to educate adolescents on abstinence and contraception to prevent pregnancy, sexually transmitted infections, which also include HIV and AIDS. What's important and applicants should key into is that the funding opportunity announcement definitely has an express purpose that applicants will address at least 3 adulthood preparation subjects. And there are a list of those adulthood subjects in the funding opportunity announcement that you can select or choose from. You can select more than 3, but at a minimum 3 are required. Also, one of the purposes would be to fund state PrEP programs in states, territories, and tribal areas. And as I stated earlier, the current PrEP announcement does not include tribes. A future announcement will be published later in this year or next year, definitely for FY 2011, that will address the tribals. Another purpose is definitely to replicate evidence-based effective programs. And again, this is key. We want to make certain that those programs meet rigorous scientific evaluation. And so definitely the replication is something, again, that you need to make certain that you're addressing as you develop your applications and your state plans. Target population, primarily we're looking at young people between the ages of 10 and 19 that are at risk for early pregnancies, and also who are at risk for STIs, HIV, and AIDS to be included, who are located in high birth rate areas and for teens and people. And so that's the primary target age, but we also have included, and this is also a part of the legislation, pregnant youth who are under 21, as well as those mothers who are under the age of 21. Another clause as it relates to target population, all applicants are encouraged to serve specific priority populations as long as there is a sound rationale for supporting data for those populations, those special or specific priority pops. And also, you should clearly define the target populations by age group, priority populations when appropriate within geographic areas that have a high teen birth rate. Who's eligible to apply for the PrEP program grant? Actually, the 50 United States, as well as 9 jurisdictions, which include D.C., Puerto Rico, U.S. Virgin Islands, Guam, American Samoa, Northern Mariana Islands, separate states of Micronesia, the Marshall Islands, and Palau. We've received a lot of questions as it relates to who can make an application, and definitely the legislation and the FOIA specifically outline states and territories. We have used the term state, which will be utilized to include territories as we share additional information with you about the program. So when we say the word state, we're also including these 9 jurisdictions and our territories. Funding, the minimum allotted funding for PrEP is $250,000. And would also want to draw your attention to Appendix B of the funding opportunity announcement that speaks to specific allocation for each of the states and our territories or jurisdictions. Okay. And the formula was determined based on the proportion of young people between the ages of 10 and 19 in each of the states. And calculation was determined based upon the amount of funding available, and that's how we were able to calculate the allocations for each state. And again, those allocations are in Appendix B of the FOIA. Cost sharing and matching, as well as maintenance of effort is required. Cost sharing and matching is not required, but maintenance of effort is required for the PrEP. Again, no cost sharing, no matching is required for PrEP. While not required, applicants, however, are welcome to devote resources to the project. Also want to make you aware that funding programs should build on but not supplant current federal, state, local, or community programs. So this is not replacement funding for programs and or services that PrEP or teen pregnancy prevention type services would ordinarily provide to young people in your state. But it's an add-on for additional coordination and additional resources to that population. Award information we want to make available and to you, and it's also in the FOIA. We're planning to award awards of 59 and 59 actual grants, and these are mandatory formula grants. There is no competition. Funding range is from $250,000 to approximately $6.5 million. Our project period is up to 5 years, and we'll talk a little bit more about how that project period works in relation to the actual number of years and or months that are allowed for the expenditure of grant funds. The award date is September 30th, 2010, on or before. More than likely it's going to be September 30th. That's what we're aiming for. We're on a very short timeline, as you're already aware, but that is our goal, to make certain that we're able to award the FY 2010 funds. State applicants may only submit one application for PrEP, only one application per state. Program expectations. There are multiple program expectations listed here. These are also all included in the FOIA. Just to highlight a few, definitely replication of evidence-based effective programs, developing logic models to include the program-specific goals and objectives, and those logic models we're expecting to see with your post-award state plans. I missed the first one. Emphasizing abstinence and contraception is primary, and both are to be emphasized, abstinence and contraception. Providing information on support activities that again emphasize abstinence and contraception. Making certain that programs and models are age appropriate, medically accurate, and complete. The development of the post-award state plans are also a requirement. Collecting and reporting on performance measurement data, as well as adhering to the evaluation expectations. And all states will not necessarily be a part of the federal evaluation, but all states in their applications should indicate their availability, willingness to participate in a federally led evaluation. As it relates to the program model, we have provided for you a list of potential models, programs, evidence-based effective programs that can be utilized, but this is not an all-inclusive list. You may also choose to select a model that has already undergone other effective, rigorous scientific research evaluation. And so you're not limited to those that are part of the list in Appendix A of the FOIA, but those models that are selected, there should be some evidence of rigorous scientific research on that particular model and its effectiveness in changing behavior as it relates to sexual activity in young people. We're also looking for models that are presented by applicants or for actually applicants to make certain that models, that they can adhere to the fidelity of the model. And so how well the program is implemented without compromising its core content, and all of that is essential for program effectiveness. So we're looking for information as it relates to that. And primarily that information will be presented to us in your post-award state plans. Adaptations to the program models. Significant adaptations would more than likely address the adult preparation, which is a requirement based on legislation for this particular program, and you're having to incorporate at least 3 of those, as well as any adaptations that are necessary for abstinence and contraception for the prevention of pregnancy and the sexually transmitted infections, HIV/AIDS to be included. The adaptations, however, should not alter the core components of your program model that you're proposing. Medical accuracy and age appropriateness are also requirements. Access to health care and other resources and support as available and as necessary for the population being served. Should also be information that's included in your post-award state plan. And so we're looking at what type of coordination, collaboration efforts are in place to address other issues that young people will bring who are in need of the pregnancy prevention services. As it relates to evaluation strategies, we actually, again, on the federal level, FISB will conduct a federal level evaluation, and that information regarding the evaluation, the specifics are forthcoming to you. We will be providing those prior to the end of the first year of award. Additionally, performance measures will be expected to be submitted by all of those awardees. And again, information in regards to performance measures will also be made available prior to the end of the first year of awards, which will be prior to the end of September. We can look at a deadline date. You'll receive that information prior to September 30th of 2011. And primarily, again, this is outlined in the FOIA, but wanted to bring to your attention what the performance measures are as it relates to the scope, what we'll be looking for in your reporting and submitting performance measure data. Okay. Moving on to application content. Applications are due on August 30th. And there are some standard documents that are required for submission. There are several standard federal forms that will need to be submitted with your application that is due on August 30th. The first of which being the SF424 and the SFP-PSL. That is a new form, project performance site location, new form that ACF is now utilizing. You may not be able to complete it in its entirety with your application submission. Complete what you can, because we know that many of your sub-awards have not been determined at this point and the specific site for the service delivery. However, we definitely do need those forms completed to the best of your ability, and you will have an opportunity to update them with more actual information when you submit your post-award state plan. Okay. The 424A is budget information. Again, we're looking for your best effort there, and that we know that all of your collaborations and determinations for areas of service will not be determined by August 30th, but provide as much information as you can on that particular document as well, and you'll have an opportunity to submit modifications with the post-award state plan. The 424B, assurance denying construction, is fairly straightforward, and you should have no problems completing it, obtaining the necessary signatures and dates for that, as well as the other two, the certification regarding lobbying and the certification regarding environmental tobacco smoke. As it relates to disclosure of lobbying activities, that form is required, and you more than likely will be submitting a more comprehensive form. As it relates to the SFLLL, when you're submitting your post-award state plans, based upon lobbying information relative to your sub-awardees, if applicable. Want to make a special note to include your D&D Data Universal Numbering System DUNS number on the SF424 and item number 8C. And there are instructions within the funding opportunity announcement on how you can obtain the D&D or the DUNS number. This slide provides a breakout of all of the budget categories on the SF424A. And also, most of the categories definitely, yeah, they're all there. And just want to bring your attention to travel. As it relates to travel, we look at what's out of state or long distance travel in that particular category. We'll draw your attention to the funding opportunity announcement, which includes a requirement for one 3-day annual meeting as well as one 2-day regional meeting. Okay. There have been quite a few questions submitted via phone and email as it relates to access to the SF, or standard federal forms. We have here for you the link, and that information is also provided in the modified funding opportunity announcement under the frequently asked questions. The link to forms that are fillable and downloadable for submission with your hard copy application. The contents of the application, in addition to the standard forms which we've already reviewed, would also include a letter from the authorized representative or transmittal letter. We received a significant number of questions in regards to this particular item as well. This information should be submitted by the state agency that was delegated by your governor's office or governing official to actually make application for PrEP. It should also include citations or a citation that establishes the authorized representative's authority to apply for and administer the PrEP grant programs on behalf of the state. This transmittal should be submitted with your application. Okay. You should also include the Code of Federal Domestic Assistance number, and I provided that for you. It's also located in your FOIA, well, in your copies of the FOIA. Again, want to reiterate, the governor's office or governing official's office in your state or jurisdiction determines the designated department or agency authorized to make application for the PrEP grant. Okay. Another item for your application that should be included is the abbreviated program narrative. Due to the limited amount of time for responses to the published FOIA, which is 30 days, and again, I want to reiterate the due date is August 30th, we have provided for you the opportunity to submit an abbreviated program narrative that provides some general program description information. And again, we'll look forward to more descriptive, concise information in your state plans. But we definitely need to have a glimpse of what your state is proposing as it relates to the requirements of PrEP programs. The abbreviated program narrative formatting should be double-spaced, 8.5 by 11-inch size pages, and that's letter size. 1-inch margins, top, bottom, left, and right, at least 12-point font. All pages, charts, figures, tables, all items that are a part of the abbreviated program narrative must be numbered, and the maximum length of pages for the abbreviated program narrative is 10 pages. As it relates to funding restrictions, we have a number of funding restrictions. However, would want to highlight for you that the drawdown of awarded funds will be restricted pending the submission of your post-award state plans. And that's for those states that are awarded PrEP grant funds. Once those funds are made available to you, which should be September 30th, there is a restriction on drawdown until the post-award state plan has been submitted. As it relates to maintenance of effort, again, this was mentioned a little earlier, the funds are not intended for supplanting or reducing your current level of services as it relates to teen pregnancy prevention, but definitely as an add-on to those services, making additional services available to those populations. It is not, again, for the purpose of supplanting, and that's what the maintenance of effort statement in the FOIA represents, and making certain that states can show that they're actually adding additional services and interventions for young people, for youth, as it relates to teen pregnancy prevention. And again, the support of those pregnant and parenting mothers that are under the age of 21. Subawards, what's important here is that states are only eligible applicants if awarded the PrEP grant, and states are responsible for fiscal control and oversight in the administration of those grant funds. States may make subawards, and those subawards will not be, or the manner in which those subawards are made will not be dictated to you by the Family Youth Services Bureau of the federal government, but should be in compliance with your state, local, or policies, regulations, and legislation as it relates to subawards. via contract or sub-grant. Lastly, if there are any questions, again, you can type those in, but you will not have the ability to speak during the webinar. Application submission instructions. Again, the application due date is August 30th for FY 2010 funds. As you may have read in the application, we will have funds available for 2011 as well, and states can opt to make applications. They have the option of making an application in April for FY 2010 and FY 2011 funds that are allocated based on state allocations, again, in the Appendix C of the FOIA. And so you have an option to submit an application August 30th based on FY 2010 funds that are available. You also have the option of making an application on April 29th, 2011 for 2011 funds as well as 2010 funds.
And a little clarification, this is Debbie Howell again, the Acting Associate Commissioner. I want you to know that that April date, you can submit something before that. If you choose to submit a 2011 application, you may submit the application on or before April 29th. Another point of clarification, if you are prepared to submit two requests for applications 2010 and 2011, you may do so by August 30th. However, please be clear that we have a separate chart in the FOA for the documents that are required for 2011 submission. We're really not thinking that people will be ready to submit their 2011 application by August 30th, but you may. And then you can submit your 11 anytime up to April 29th, 2011. So we don't want you to think that you have to wait until April 29th, 2011 if you are ready to submit an application for 2011 funds.
And one other point of clarity as well. If you decide not to apply for 2010 funds, you also have that option. You can just submit an application, as Debbie stated, for FY 2011, solely for FY 2011, without requesting 2010 funds. So you have the option of that as well.
So you can also, because this is a 5-year program, which is from 2010 until 2014, if you just can't submit your application in 2010 by August 30th or September 30th, you can also submit your application for 10 and 11 as well. So it's no, you don't have to say, well, I can't get it done by 2010, but that does not prohibit you from submitting 2 applications in 2011, meaning you're going to submit an application for 2011 and provide to us all the information we asked you to provide in that chart. And you can also go back and say, I also want my funds for 2010 as well, and you have to submit to us the application as well as the state plan. So I'm hoping that's clear, and if it's not clear, please start to develop your questions now.
All right. Okay, how to submit your applications. Unfortunately, we were not able to utilize grants.gov, the electronic submission process. So the only 2 ways at this point that you can submit those applications would be either by mail or hand delivery. Please do not submit applications via facsimile or via email. The only option for submitting applications, again, will be via hand delivery or U.S. or overnight mail, whatever mail service you select. Okay? And those applications should be submitted to my attention at the address that's provided in the funding opportunity announcement and here. Okay. Application tips. Just to reiterate, please make certain you adhere to the requirements for submitting your application as it relates to the abbreviated program narrative. We need an original as well as a copy, so you'll be submitting 2 copies, an original and 2 copies. Let me restate that. You will submit an original and 2 copies of your complete application packet, which includes your standard federal forms, the abbreviated program narrative. I would advise you to definitely go to the FOIA and Section 4 and review the charts that are provided that speak to the documents that are required for the application and the state plan. Okay. No double-sided copies, please, and no other extraneous material. Okay. Application tips, definitely reading the FOIA is beneficial to understand how to submit your application as well as post-award state plans. We will be providing additional information as far as technical assistance as it relates to the state plans at a later time. But definitely you want to make certain you read the FOIA and make certain that your abbreviated program narrative does not exceed the 10 pages as requested, and that you would meet the due date of August 30th. Again, that date is crucial in order for us to make awards by September 30th for FY 2010 prep dollars. Okay. Another tip, follow what the FOIA says. Pretty much the requirements are very well laid out there, and if you follow, you should have no problems in submitting the documents that are needed for review and award. Award notices will be made shortly after September 30th, and those awards will come to you from our Office of Grants Management in the form of a financial assistance award document, and there will also be a cover letter that speaks to the award, your award, and any other special instructions that need to be followed at that time. Post-award state plans as it relates to prep. Again, we're going to provide additional information through technical assistance, but there are some basics that are outlined for you in the funding opportunity announcement as it relates to information that we will need. It's really, actually, the FOIA is really specific as it relates to the information to be submitted about program implementation, development, your models, your sub-awardees, any implementation plans. So all of that information, again, is laid out in Section 4 of the funding opportunity announcement, but we will be providing additional information prior to the due date for those plans. And that due date is, I got that right here, February 1, 2011. All post-award state plans must be submitted no later than February 1, 2011. Again, state plans, as Debbie stated with the application, state plans can be submitted prior to the actual due date, but the absolute due date is February 1. The required documents are listed here in the slide, but also they're outlined again. I'd redirect your attention to the table that's in the funding opportunity announcement in Section 4. The standard federal forms that I spoke about that should be included in your application, those forms, as applicable, can be resubmitted with your state plan with any edits, modifications, or updates, and that your sub-awards and also possibly the selection of the specific or actual target communities, target population, geographical areas may not be determined until you move into your planning phase. So what FISBE will do in turn with your post-awards, review those. We definitely will have technical staff take a look at the medical accuracy of the curricula that's being purported for your particular state. And we're asking that you not submit curricular-related information for your August 30th application if you would hold that information until you submit your post-award state plan. As stated a little earlier, we indicated that there is funding also allocated for prep for tribal communities, and at this point, again, funding opportunity announcements are not available. A funding opportunity announcement is not available for the tribe prep funding, but it will be published in the very near future. And so here we provided with you information on how you can receive updates from grants.gov as it relates to forecasts for future announcements.
This is Debbie Powell again, and wanted to give you some additional information about the tribal funding opportunity announcements. The statute required, the PREP statute required that the funding opportunity announcement be developed in consultation with tribes and tribal organizations. So that is the primary reason why we could not have the same track, have the tribal FOA on the same track as the state FOA. We are now in the process of fulfilling that requirement of tribal consultation. And I wanted, if anyone that's interested, I'd like to tell you that on the FISB website, we have information about tribal consultation meetings that we will be attending to gather information about how they feel the FOA should look. We also have national conference calls scheduled. We had one conference call in July. We have 3 more scheduled between now and October. So anyone interested in the tribal FOA, please go to our FISB website and look at the dates of the tribal conference calls and the locations that we will attend and provide status reports and updates about the FOA design.
Thank you, Debbie. All right. All right, we're going to look to see what questions they have as it relates to PREP that we can respond to now before moving on to discussion about the abstinence program. You can bear with us for a second. There are a lot of questions here, so bear with us as we try to pull up a few of those. Okay, one of the questions that we have here is if we are the state-designated Title V MCH agency, are we the only agency who can apply? And the answer to that is no. States do not have to utilize the identified Title V department or agency within that state for applications for PREP, to make applications for the PREP program.
The governor and in other jurisdictions, the governing body will decide for that state what office will represent the state for the PREP program. We are not aware of any designations at this point, but the states are aware. They do have copies of the FOA, and it's the state's responsibility to identify what office within their state should administer the PREP program.
Okay, we have one other question that we may be able to get to, and that states, even though there will be a separate PREP opportunity for tribes, are states allowed to support PREP activities in tribal areas with the state PREP dollars?
The statute has no prohibition for what population you serve as long as the population fits the criteria in the legislation. So the answer would be no. We don't. If the state decides that the target population they choose to serve is in compliance with the statute as it relates to age and at-risk populations, yes, you may include those populations as your target population.
Okay, there's one other question as it relates to the maintenance of effort. And the question is, I'm sorry, at this last part, is there an MOE, which is maintenance of effort for the PREP grant? And yes, there is. And there is a section within the FOA that speaks to the maintenance of effort.
Do we have access to the slide? Okay. We did address the MOE, and it is in your slide presentation. And we'll go back to it and have Sabrina restate the requirements of the MOE to not supplant funding that is currently being used to support teen pregnancy prevention programs, but to supplement. So give us a second to go back to that slide.
Get back there quickly as possible. Okay. As it relates to maintenance of effort, just to reiterate what Debbie has just stated, again, supplanting and reducing current service levels as it relates to teen pregnancy prevention is not the purpose of PREP dollars, and PREP dollars cannot, our funding cannot be utilized for such. Okay. And the activities, programs, and initiatives that qualify under maintenance of effort are non-federally supported activities, programs, and initiatives to educate youth on both abstinence and contraception for the prevention of pregnancy and sexually transmitted infections, which again includes HIV, AIDS, and also what's included are the adulthood preparation subjects that are a requirement for this project. And let's see if we can get one more question, have one more question answered before we move on.
Tobacco certification does not have a place for it. By signing your form.
If I can get that real quick. Okay. The certification regarding environmental tobacco smoke does not have a place for a signature. I'm assuming that's okay. I have to take a second look back at that form, Debbie.
When you sign your SF-424 and when you sign your application form that you are requesting to have funding allotted to your state, you are certifying that you are aware of the certification for tobacco-free and you are agreeing to that certification.
Okay. And we have a question regarding budget. How many years of budget do we submit with the abbreviated application for PREP? For FY 2010 only or for FY 2010 and 2011?
If you're submitting an application by August 30th for FY 2010 funding, you're only submitting the budget for that year. When you submit your application for funding for 2011 prior to or on April 29th, you will be submitting it for 2011. So the expectation is that you will submit a budget for each year of funding.
I guess we'll take one final question. If we submit our state plan before February 1, will we be able to draw down funds before the due date?
Yes. If you submit, the FOA specifies that the state plan is due on or before February 1, and you may be able to draw down your funds with the submission of the state plan. So yes, with the submission of the state plan and our review, if it happens before February 1, yes, you can draw down your funds.
Okay. Thank you so much for your questions. We will not be able to address all of them at this time, but we will hopefully be able to record these and be able to respond accordingly.
And please, we direct you to the all modifications, because I think you'll find that many, if not all of your questions will be answered, and there's frequently asked question modification to the FOA.
Okay. At this time, we're going to switch gears and speak to the state abstinence funding opportunity announcement. Again, very similar legislation authority as that of the PrEP. One of the differences would be in the first bullet for this slide as it relates to the Patient Protection and Affordable Care Act is that the reference should be to Section 2954 as it relates to the restoration of abstinence funding for the abstinence program. Okay. The other information is very similar, and it's available to you in your funding opportunity announcement. Okay. The purpose of this particular funding announcement, which is different from PrEP, is that it promotes abstinence from sexual activity. Okay. Develop flexible, medical, accurate, and effective abstinence-based plans is one of the purposes that are responsive to specific needs. Another purpose is to provide abstinence education, as well as providing mentoring, counseling, and adult supervision to promote abstinence from sexual activity where appropriate. The target population primarily is that we're expecting projects to focus on groups that are most likely to bear children out of wedlock, such as youth in or aging out of foster care. That's just one example, and additional information, again, is provided as it relates to the target population for the abstinence program. Who's eligible to apply? This slide is pretty much identical to PrEP in that applicants are inclusive of the 50 United States as well as the 9 jurisdictions and our territories that are listed here and also listed in your FOIA. The funding for the state abstinence program, the actual determination of allotment are quite different from that of PrEP. And actually it's based on a formula using the state's proportion of low-income children compared to the total number of low-income children in the U.S. based on the most recent census data for children in poverty. And just want to point your attention to the FOIA, to Appendix A, where you'll see a list of each of the states, territories, and or jurisdictions with their allotments. The allotments or allocations will range from 21,000 to approximately 6.1 million. And again, census data drives the determination for those allocations, as well as available funding, which is $50 million in total for the state abstinence program. As it relates to cost sharing matching is a requirement, and it looks like a little glitch here. Hold on for 1 second. Like we had a slight glitch in our slides. If you bear with me for a second. Here we are. Cost sharing definitely is required. Unlike PrEP, there is no cost sharing or matching for PrEP, but for state abstinence, cost sharing is a requirement. The applicant must fund at least 40% of the project. 43%, thank you, Debbie. The applicant must fund at least 43%, and ACF will fund no more than 57%. An example is provided. If a state total program cost is $100,000, ACF or FISB will award $57,000 $30,000, and the state must provide a match for the cost sharing of $43,000. Again, it is our goal to award upwards of 59 awards based on applications. Type of award, again, this is a mandatory formula, very similar to that of PREP. The funding range that we're looking at for the state abstinence, I've already reviewed that. We're going to move on. Okay, the program expectations. For the state abstinence education program, primarily we are looking for applicants who are able to provide abstinence education to those target populations that were mentioned earlier. The determination of relative emphasis to be placed on each of the required A through H components is also an expectation. All of the components A through H must be a part of the project and our program. However, we are leaving it to the discretion of each state applicant to determine the relative emphasis, okay? The level of emphasis that you place based on A through H requirements. And you'll find that in Section 1 of the funding opportunity announcement, a list of alphabets A through H and those components.
Excuse me, yes, we identified the section in the FOA that specifies what the funding for abstinence can be used for, but I want to make sure I bring your attention to that same section, which specifies that states may also use their funds for mentoring, counseling, or adult supervision programs to promote abstinence. So that's also very prominent in the statute and in our FOA, so I wanted to bring your attention to that narrative there.
Thank you, Debbie. All right. Also, definitely want to make certain the expectation is met. Should the abstinence from sexual activity is an outcome, an expected outcome of your project, and that programs are medically accurate and effective at reducing teen pregnancy. Other expectations would include that applicants would submit a logic model, and the logic model would be inclusive of specific goals and objectives for the teen pregnancy, it is teen pregnancy prevention, but for the abstinence education program. Also that you would develop a post-award state plan. Select and report performance measurement data is also an expectation or requirement. Medical accuracy would be another component that we're looking for in your applications and or state plans, that the actual models for the particular project that you select would include the requirements for medical accuracy, which means the medical information must be verified or supported by way of research conducted in compliance with accepted scientific methods and published in peer-reviewed journals where applicable, and additional information that substantiates medical accuracy as far as what we're looking for in your applications is also included in the FOIA. And there's a section in Section 1, a subsection in Section 1 that speaks specifically to medical accuracy. Okay, application content. Again, to redirect your attention to Section 4 in the funding opportunity announcement, there are charts available there for you that speaks to what documents are required for your application versus your state plan, the post-award state plan that will be due in February. And so, as far as the application, we definitely need those standard forms. The list is very similar to that list that was reviewed for the PrEP program. The only exception is for the abstinence program. We are not requiring that you submit the SF424A. Again, all of the forms are the same except for state abstinence. You will have an opportunity to submit the SF424A, which provides for us the budget breakout based upon the pre-established categories for your budget for your federal funding as well as for your match funding, and that information is to be submitted with your state plan. If you opt to submit it with your application, that's fine, but the requirement is that it should be submitted with your post-award state plan. Again, to remind you to include the DUNS number and item 8C on your 424 SF424 application.
And just to connect the abstinence with the question we had for PrEP about if you submit your post-award state plan prior to the date that it's due, can you draw down funds? And with abstinence, when you submit your post-award state plan and it is approved by ACYS and FSBE, you will then be given the approval to draw down your funds. So it must be an approved plan, and then you get to go ahead to draw down your funds.
Again, just to share with you, in the FAQs based upon submission, we modified the funding opportunity announcement to include some of the frequently asked questions that we've received to date. And if you look at that list of the modified funding opportunity announcement, you will see this web link, but we've provided it here for you as well, which is where you can find those fillable, downloadable forms to be submitted with your application and or state plan. I just want to reiterate one other thing as it relates to the standard forms. Again, if you're submitting the required forms with your application and after the planning process determine that there should be edits, modifications, or updates, please resubmit those forms noting or indicating those modifications. Actually, you would not need to submit the previously submitted documents, but go in and actually fill and download and submit new forms that speak to the modifications. Okay? Contents of the application also would include the letter from the authorized representative. We're also referring to that document as the transmittal letter, which also, again, that needs to be included. And if you would pay attention to the note on this slide, again, lots of questions have come to FSBE as it relates to how that determination is made for the state agency that will make applications for the state abstinence program. Again, one of the questions about the Untitled Chapter was asked earlier today too. The agency that makes application within the state or that's designated by the governor's office or governing official does not have to be the declared Title V agency for that state. The governor's office or the governing official for your territory or jurisdiction can make a determination of any of the state or agencies and or departments to make application for state abstinence. And again, there needs to be a citation or some other form of documentation that establishes the agency who's making application as being designated by the governor's office or the governing official's office. The application abstract and abbreviated program narrative. Statement and process statement. Again, we're asking for general description of how you plan to utilize and implement the abstinence program with additional details to follow in your state plan. The formatting is pretty much the same as that of the state PrEP program. The only difference here will be the list of pages for the abbreviated program narrative. For the state abstinence, the maximum length of pages for the abbreviated program narrative is 5 pages. For PrEP, it's 10 pages. And again, that's inclusive of all the pages, charts, figures, tables. It is not inclusive of the standard form. Standard forms do not have to be numbered. Funding restrictions are very similar with both programs. We're requesting, requiring applicants that are awarded abstinence funds not to draw down those funds until your post-award state plan has been submitted and approved. It has to be submitted and approved before those funds can be drawn down. Sub-awards, again, bring your attention to note. States are the only eligible applicants. So when those sub-awards are made, and again, to reiterate, sub-awards that are made are at the discretion of the state based upon your state and or local regulations, policies, and legislation. Application submission instructions. Again, the due date is August 30th. We've probably said that 1,000 times today, but we want to make certain everyone is clear of that due date and make certain that you get those applications into us either by mail or hand delivery with the attention of LaBrita White. And the address is provided here and in your FOIA. Again, there is no option to submit the application electronically through grants.gov. Please do not submit applications via facsimile or email.
And I just noticed a little inconsistency. I don't want you to think that the abstinence and the prep are going to different buildings or different suite numbers. And so the suite number should read 8,000. It reads 8,000 on the prep, and it should read 8,000 on the abstinence. So just add another 0. Thank you.
Okay, and our application tips are basically the same. Just want to draw your attention that we will need an original and 2 copies to be submitted. Can't say enough. Please read the FOIA. All of the instructions are there as it relates to your application and state plan, even though we will be providing additional support around the development of those plans and what we're looking for in those submissions. And please do not exceed the 5-page limit. Follow what the FOIA says. Award notices, again, the Office of Grants Management will provide notification as it relates to awards made after the review of the application. Post-award state plans for state abstinence. The information is very similar to that that was provided for the state prep. And it's very well defined in the funding opportunity announcement in Section 4. I would suggest that you read that very closely and clearly. And again, we'll have opportunities to provide additional information to you as it relates, once awards are made as it relates to the state post-award state plan.
So please take notice that there's 2 different dates, 2 different due dates for the post-award state plan. For abstinence, it's December 10th. For prep, it's February 1st. So just don't want you to get those 2 confused.
And again, I would turn your attention to Section 4. I would say it's subsection A, that speaks to a chart that provides an outline for you as to which documents are to be submitted, and there's additional narrative in Section 4 and more specifically defines the program narrative, which is quite more of an extensive document that we're looking for with your post-award state plan versus the 5-page abbreviated program narrative with your application. There was a general question that came to BISB in regards to both of the funding opportunity announcements for those states who were completing applications. Wanted to know how the periods for our fiscal years, and so we provided that information for you. And I'll just review the first. For fiscal year 2010, you'll see the importance of us receiving and reviewing and awarding your applications by September 30th, because that is the final date of the fiscal year for FY 2010. And we definitely want to have those funds available to you if at all possible by 2010. Again, for the state prep, just know that if you are unable to make the August deadline, you can also apply for FY 2010 funds with an application in FY 2011.
And just a point of clarification, I told you earlier that it's a 5-year program, and funds are available for prep from 2010 through 2014. For abstinence, it's a little different. It's a yearly appropriated program. So that's what we're saying for abstinence is just crucial that we make these awards by September 30th, 2010, because the money is no longer available as of October 1. So that's the difference between the programs. The PrEP program is a 5-year appropriated program. The abstinence program is appropriated on a yearly basis. So we must have money out of the door before the end of that appropriated year, which is September 30th. And when I say out the door, that means they have to actually be in the system, in the grant system, and obligated. You won't be able to draw down, but the awards will be actually made obligated in our federal system. So it'll give the appearance that the money has been used. So it won't lapse and go back to Treasury. So that's the difference between the two programs as it relates to appropriation.
Okay. Thank you, Debbie. I don't know if we mentioned either the funds that are awarded for FY10 for the state prep program, that states will have 2 years to expend those dollars if they make application and are awarded by September 30th.
So please, thank you, Labria, for bringing that up, but I don't want to discuss that at this point because it's really clearly identified in your form, so I don't want to confuse anybody about the funding. So basically both programs, which is a good thing, I think, the statute allows that both programs have the opportunity to spend their money in a 2-year period. So if you get funded in 2010, you get an opportunity until 2012 to actually spend all of your money before it goes back to the Treasury. And I think that's the way the absence was before, so it's not a change for the people on the line that was awarded an abstinence grant in the past, a state abstinence grant in the past. But PrEP is a new program, but it's all in the FOA. We're not saying anything that's not identified in the FOA. And I also want to remind you again that on our website, as we speak, we've already loaded the FAQ, which is the Frequently Asked Questions, on our website, and they will answer all the questions that we've received by telephone and in writing. It's a very comprehensive document, and I really think that once it's read along with your FOA, that everything will be clear and everything will be answered at that point.
Thank you, Debbie. We have a few questions that, looking at the time, we have approximately 5 additional minutes left, so we will try to respond to as many as possible. Okay. We have a question for clarification of dates. The question is, can you clarify the April 29th, 2011 and February 1, 2011 due date? And that question, I'm assuming, is in reference to the state prep. Okay, the April 29th, 2011 deadline is for FY 2011 award for the state prep program. And what's due on the 29th are your applications as well as your state plans, and that's for state prep. Okay?
And that's for 2011. And you will see, I want to give you some background about why we have a 2-step process in 2010. It's because we wanted to give you ample opportunity, ample time to really give us a quality product and to have your program really thought out. And we knew that 30 days would not give that to you. So we did it in a 2-step process. We only asked you in the initial package, your application, which is due August 30th, just to give us the basic forms, the forms that will allow us to go into the system and obligate that money. So that's what you have for your application for funding. And that's why we asked you to abbreviate your narrative and keep it to 10 pages for the prep. We wanted to impress upon you, we're not looking for a lot from you because we understand that you will not have the time to really put together a comprehensive package. So that's why the two-step process, and that's why the restriction of 10 pages for prep and 5 pages for abstinence. We were hoping that we were sending you the signal that we don't expect you to have to pull your hair out and try to put together a whole package for us. The April 29th, 2011 date is because, and you'll see in your FOA that we explained to you, and the statute clearly says that for states that have not submitted an application for 2010 or 2011, that funding will go to organizations, nonprofit organizations in your state. So we must know that information by a certain time, so we'll know we have to put out a different FOA for that particular state to ask organizations to come in and apply for that money. So that's what the April 29th date is giving us. It's giving the federal government notice that the states that submit something in 2011 that didn't submit in 2010, that they actually do want their money, or they don't want their money. If they don't want the money because they didn't submit us anything in 10 or 11, we now will go and put a funding opportunity announcement out for organizations to apply for that money for that particular state. There will be a discretionary grant application. So we want to, and all that is identified and explained to you in the FOA.
All right, and we have another question. If we are able to submit our post-award state plan early, in parentheses, before February 1, 2011, does that mean we can draw down our funds before then? For the February 1 that relates to our state prep, yes, it does give you some additional lead time. We do need to review, however, your state plan, but it could potentially decrease the amount of time before you are allowed to draw down funds.
Because we take you back to the FOA, it will tell you that that's the due date for your post-award state plan for prep, February 1. But it also gives you another date in that FOA that allows the government time to review. So if you submit your FOA, your post-award state plan on March 18th, that may not give the federal government enough time to review that plan in order for you to be able to draw down your funds a day later. So that's also explained in the FOA. So we have to have time to review the plans we receive. So we can't guarantee that if you submit your state plan 1 week that your funds will be available for you to draw down on the next week. But the earlier you submit them, the better that chance is.
Right, there's a potential for that. We have, I think we can take maybe one last question because we're running out of time, is what can restricted funds be used for? The restricted funds we're asking that you not draw down those dollars. There's a restriction to not utilize the funds until the state plan is submitted, reviewed, and approved.
Your restricted funds, your whole allotment. So if you're from California, say, I don't even have the allotment table in front of me, but if you get $6 million because your allotment, that's what it is for California, that means that you can draw down none of that allotment money until your plan has been submitted, your state post-award state plan has been submitted and the federal government has reviewed it and given you the approval. And we will identify for you when that review time has been completed, and we will let you know that your funds are now ready to be drawn down. All of your allotment will be restricted until we receive the post-award state plan. It is reviewed and approved.
Okay. Unfortunately, we are out of time. There are a few more questions. We will try to review those, and if possible or if necessary, if they're not already answered with the FAQs that are now a part of the modified SOAs, we'll make that information available. Again, we're out of time. It's now 5:30. We want to thank all of you for participating with us on today. Hopefully this information was beneficial. It was helpful to you as you're developing your applications. We encourage you, I can't say it enough, definitely always reference back to your FOIA because it gives you specific instructions on what to do, what's needed with descriptions for each category as it relates to the requirements. So please heavily depend upon the funding opportunity announcement. We look forward to working with those of you who will receive awards. Again, thank you for your participation on today. I'm going to ask Cindy if you have any closing remarks.
And this is Debbie Powell again. I want to also thank you for your interest. I'm really excited about the number of participants we have on the line today. So that means that there's going to be a great initiative out there for teen pregnancy prevention for our young people. For the fact, federal frequently asked questions, what we also did to help you is we actually referenced each section in the FOA where you could find the answer to the question that you asked. We answered your question, but we paraphrased right out of the FOA. You will see that there's nothing new or changed in the FOA because we referenced each one of our answers back to where it can be located in the FOA. So thank you once again, and thank you once again, and good evening. I thought we were about to be cut off. Is Wendy back on the line?
I'm not hearing from her, so I'm assuming we're all done. Again, as Wendy stated at the beginning of the call, we will make information from this webinar available to you through the FISB website, and that information will be available to you. Again, it's the FISB website, and you'll have to look to the immediate right of the home page for new information. We currently don't have a specific link among the other general links for all of the programs under FISB because this is so new, but you should see a link to the immediate right of the FISB homepage that will provide you a direct link to the recording and additional information based on today's discussion. Again, thank you and have a great evening.
Thank you.